My name is Lastacia Miles, and I'll be presenting my capstone project proposal for the MSN program at the University of West Georgia. The title of my project is The Professional Development of the Novice Assistant Nurse Manager. I'll begin by presenting the problem, followed by the learning objectives that will guide the project. I will briefly explain the theoretical foundation supporting the project and summarize the literature review to include the teaching strategy and evaluation methods that I plan to use. I will describe how the project will be implemented and conclude the presentation with the impact the project will have on outcomes in nursing education. This project took place at a Level 2 trauma center in the southeastern United States, working with baccalaureate and master's prepared nurses promoted as leaders over the past 2 years. This hospital recently promoted assistant nurse managers to help alleviate some of the burden placed on the nurse managers. In total, 10 nurses were included. This inclusion criteria were staff nurses promoted as nurse leaders over the past 2 years, and the nurses currently employed as nurse leaders in either an acting or confirmed position. In order to build a trusting relationship with the learners, I was prompted by my preceptor to email out a professional bio just to inform everyone of my background and to break the ice. Afterwards, I was formally introduced and also shared multiple conversations with all the assistant nurse managers I was working with. This helped to alleviate any type of discomfort and to establish the groundwork for my project, which eventually led to the development of the problem at hand. To accomplish this transformation, strong leaders should have the knowledge and skill set necessary for transitioning organizations into the future. Instead, nurses are being promoted to leadership positions with very little preparation and without demonstrating competencies for effective leadership, which places the assistant nurse manager at risk of failing to carry out organizational goals effectively. Speaking with the assistant nurse managers allowed me to understand their perspective, their frustrations, experiences, and challenges, both past and present, based on their promotions as nurse leaders. With the help of my preceptor, we decided to focus on educating novice assistant nurse managers on leadership and personal development skills that contribute to practical competency. The project's objectives are for novice assistant nurse managers to explore self-developmental concepts and evaluate strategies to improve leadership skills. These objectives will help the assistant nurse managers achieve organizational goals and meet quality care demands, which will eventually lead to better patient outcomes. The educational theory foundation for this project is Jack Mezirose's transformational learning theory. Transformative learning is a theory of adult learning that utilizes dilemmas to challenge students' thinking. Students are then encouraged to use critical thinking and questioning to consider if their underlying assumptions and beliefs about the world are accurate. Mezirose used this theory to describe how people can develop and use critical self-reflecting to consider their beliefs and experiences to change how the world is viewed. Mezirose was interested in how people viewed the world and their embedded assumptions, referred to as frames or references. However, for this capstone project, I want to specifically focus on Mezirose's 4 concepts of learning. These 4 learning concepts involve elaborating on an existing point of view, establishing new points of views, transforming the point of view, and becoming aware and critically reflective of our generalized biases. The use of transformative learning theory provides opportunities for critical thinking by helping the learners generate new ideas, also by reflecting on self-biases and beliefs. It also provides opportunities to relate to others experiencing the same processes by brainstorming ideas. Another way that opportunity is provided is by acting on new viewpoints, by actively taking steps to create a new frame of. James Watson's accounts of human caring support the theoretical foundation of the Capstone project. Watson's theory of transpersonal caring guides nurses' clinical and professional advancement. The theory emphasizes the importance of authentic relationships, sovereignty, and freedom of choice. It is a framework that optimizes practices and impacts authentic leadership and self-efficacy. Watson believed that transpersonal caring in education occurs when teaching moments develop into caring occasions. Watson's unique perspective on caring eventually developed into the 10 Caritas, which are described as universal truths in which we live and work by. One way to ensure that caring is central to the teaching learning project is by focusing on the character factor of balance, which is engaging in transpersonal teaching and learning within the context of a caring relationship. The ways that I plan to apply transpersonal teaching learning is by concentrating on both the learning and the teaching process, engaging in a genuine learning experience that will promote growth, empowerment, and knowledge, and understanding the learner's present views to assist with preparing a cognitive plan to overcome the barriers. A literature search occurred to identify, evaluate, and synthesize content related to leadership practices and the best teaching techniques to improve transitioning into the role of an assistant nurse manager. The barriers are deficits in developmental opportunities and poor perceptions of preparedness when transitioning into these leadership roles. Also, one of the main issues that has led to feelings of unpreparedness is thinking that bedside nursing equates to being an excellent nurse leader. My goal is to help the assistant nurse managers to utilize the best leadership practices to improve transitioning into the role of an assistant nurse manager, and also to use the best skills and tools possible to create a healthcare environment that supports, empowers, and engages them during their transition. The objectives, the identified teaching strategy is a facilitated discussion. A facilitated discussion occurs when a group explores problems, beliefs, and questions in a way that combine the knowledge of all contributors to create an awareness that would not have occurred without interaction. It is also an effective tool for creating a comfortable atmosphere for learners to engage in difficult conversations while promoting positive behavioral changes in the Masereau believe that the educator's role is to assist in learning transformations through active, reflective actions. This happens when people are forced to reconsider their beliefs in a way that will fit this new experience into the rest of their worldview. This often happens through critical reflection in the context of dialogue with other people. So I will use Mesereau's 4 concepts of learning to create dialogue by having the learner seek further evidence to support initial biases of leadership deficits, by having the learners focus on perceived shortcomings and create a new understanding of what it means to be a successful manager in the workplace, by having the learners to focus on misconceptions and ways to bring about positive changes. Also, the learners will become aware of their generalized biases through self-reflection. To incorporate Gene Watson's caring theory, I plan to be open and present, engage in a genuine teaching learning experience, and build a trusting and authentic caring relationship with the assistant nurse managers. To evaluate the assistant nurse managers, I plan to use reflection. This is an evaluation method used to gain insight into behaviors, values, knowledge, and growth to improve self-awareness and understanding. Also, it is beneficial to the learner in identifying gaps in their skills, knowledge, and goals. And lastly, reflection provides an opportunity to learn from experiences with the educator regarding problems and struggles. Reflection aligns with both Mesereau and Watson theory in that it is a tool that supports the educator's effort to authentically empower learners to evaluate through self-learning while developing new ideas. In order to implement the teaching learning project, I plan to secure a room with hospital administration that has audio and visual equipment available, send out group invites via email, and prepare educational handouts and a self-reflection question. I will conduct 2 90-minute sessions, and this is just in case one of the leaders are not able to attend. In the sessions, I will talk about the American Organization of Nurse Executives' 3 learning domains, investing in professional development, focusing on self and others, and at the end, exchange of ideas and debriefing. The Teaching Learning Project will impact the practicum site by creating an environment that allows assistant nurse managers to learn and grow as effective leaders within the organization, by providing an avenue for creating learning opportunities for nurses interested in pursuing leadership. And it will also increase staff engagement, leading to better patient outcomes and satisfaction. My presentation on the professional development of the novice assistant nurse manager. I would like to leave you with this final thought. It is pivotal to the healthcare organization's growth and sustainability that novice nurse leaders develop proficient leadership skills. Thank you.